Hi, we're still learning lots here at the Diversity Health Fair. I'm here with Debra, who's actually the director of the BC Drug and Poison Information Center. Hi Debra, how are you?
Hi, I'm good, thanks.
So tell us a little bit about what this is.
What about the Drug and Poison Center, who we are? We're actually a telephone service, so we're a 24-hour information service available province-wide, and we're there for people who have a question about something that's either maybe a poison, or if they're worried about a friend who's maybe overdosed, or maybe they're having a reaction from a medicine or even a drug. So we're there 24 hours a day to kind of answer those kind of questions. And if someone needs to go into hospital, what we can do is we'll phone ahead and we'll let the hospital know that someone's coming and what they need to do and stuff like that. So
that's definitely a great service, because a lot of the youth, is into experimenting a little bit. So what are some of the tips that you might have for youth that is experimenting?
Well, certainly we know that happens, and I guess probably one of the biggest tips I have for people is to make sure they're partying with someone who is either a sober sitter or somebody who's being responsible for them. And if you happen to be the guy who's the one kind of responsible and you're looking out for your friends and something just isn't going right, then I would suggest you're welcome to phone us and find out if there's something to worry about or if you should do something more than just watch them. And the other thing is to make sure you're partying around someone where you can either get to hospital if you need to, or rather than out in the bush and like that. And the other thing is I know people often are really quite responsible drug users. So, we'll get calls from people who say, I've only done 2 half tabs of ecstasy and I'm having this reaction, what's the problem? And there's always reports out there of bad ecstasy and stuff like that. But often I think what people forget is that even though it looks like it's a pharmaceutical product with the little dolphin on it or whatever, you need to consider it as a polydrug. So you need to remember that there's probably in more than 75% chance more than 1 or 2 things in that tablet. So there might be MDMA or ecstasy in it, but there's often methamphetamine, ketamine, caffeine. Those are always pretty much in there as well. So people have different reactions to that. So your friend who maybe's never used it before, may not have a good reaction. So yeah, feel free to give us a call.
Okay, so definitely illegal drugs are, I guess, a big problem, but it's seen more and more now that teenagers are getting addicted to things like Tylenol or antidepressants. Do you get phone calls like that as well?
Yeah, I don't know if they're addicted to it, but we certainly, Tylenol is a interesting one in that people might not realize how poisonous it can be, because what happens is it's toxic to the liver, and so if people take more than the amount you should take in a day, you may not feel like you're sick, but 24 hours later you might have damaged your liver. So it is a concern, and it's a concern even in people who are taking it, for pain and stuff like that, and antidepressants as well. We have people, obviously everybody, you're taking an antidepressant because you're just not either feeling well in life right now, and it might be for a short period of time, but some people might feel like they want to harm themselves during that period. So if you have a friend who you're concerned about, have them give us a call, because we do take calls about drug overdoses, or people trying to hurt themselves.
Definitely. This is a great service. So what is the phone number, and is it 24 hours?
It is 24 hours, and the people who answer the phone are nurses and pharmacists who are specially trained in how to manage overdoses, how to manage poisonings. Excuse me. We have 2 numbers. We have a Lower Mainland number, and it's 604-682-5050. There's also a province-wide number, so if you travel out of the Lower Mainland, you have a friend out on the island, it's 1-800-567-8911.
Okay, and we'll definitely have those numbers available for you.
And we also have a website, so if you forget the number, we're at www.dpic.org. So it's drugpoisoninformationcenter.org.
Okay, perfect. Thank you so much for the great tips, Debra.
You're welcome.
Stay tuned to Close Look.